is it Oliver Tran?
Hi, yes.
Hi, nice to meet you, Oliver Tran. My name's Dr. Rebecca Wilkinson. I'm one of the psychiatrists working here today. I understand you've come to talk to me about a recent diagnosis that you've had and the treatments for that. Is that right?
Yeah, so I had an OCD diagnosis. I got that at the last appointment, and I think I just wanted another one to understand it, really.
Yeah, absolutely. Well, first of all, I'm sorry to hear that you've been through that, but we can definitely talk about OCD today and the treatments. Is it right if I understand a little bit about what you understand OCD is at the moment? Have you heard much about it before?
I read a bit online, and I kind of agree it's what I have. I basically spend a lot of time in the evenings sort of worrying and checking that all the doors are locked and the safety is all good. And it just really causes me to be late for my daughter pickups, you know, from school in the afternoons, and it really affects our lives in a big way. So there's lots of sort of anxious thoughts going on in my head.
Oh, I'm sorry to hear that, but the good news is there is treatment. So I'll explain a little bit about what OCD is first, and then we can talk about the treatment.
That would be great.
So OCD stands for obsessive-compulsive disorder, and like you explained, people experience what we call obsessions, but other people understand those as intrusive thoughts. And it sounds like you're experiencing intrusive thoughts that maybe the windows aren't locked in your house or the doors aren't locked. Is that right?
100%, yeah.
And then people experience the need to engage in a behaviour, which we call a compulsion or a compulsive behaviour. And it sounds like in your case that behaviour is checking.
Yes.
Other people with OCD can have lots of different types of intrusive thoughts, and the compulsive behaviours can be different as well. Sometimes they're physical, like in your case checking, but also they can be mental checking as well, so going through things in your mind. But generally it's a cycle of having that worrying thought and then having to engage in that behaviour. Does that make sense? Does that sound like what's happening for you?
Yeah, because I go around all the windows, all the doors, all the locks. Like it's just really constant checking and worrying. Yeah.
And the difficulty with being in that vicious cycle is that you get into a bit of a trap where you have to engage in the behaviour in order to relieve the anxiety associated with the intrusive thought. But then you have to do it again and again and again.
Yes.
Unfortunately, that anxiety isn't relieved for very long. So then when you get the intrusive thought again, you have to do the behaviour again to relieve the anxiety. Is that...
It makes me feel better for like a short time, and then, you know, I have to then do it again or check another thing, you know.
Yeah. And it can be really time consuming and impact your day-to-day life, which it sounds like it's doing for you. You're getting late, leaving the house, going to work, seeing your daughter.
Yeah, exactly.
That is what OCD is in a nutshell. Do you have any other questions about the diagnosis itself?
No, I think that's fine. That sort of fits what I was thinking, and I do agree with that diagnosis. Yeah, I guess now my questions are more like, what can we do about it, basically?
Absolutely. Well, it is treatable. There are two parts of the treatment that we offer, and they usually go hand in hand. So evidence shows that we offer them together, we get better outcomes. One of those is medication, and the other is therapy. So I'll start with medication and then I can explain the therapy.
Yeah, I was a bit worried about the medication. I don't want to be, you know, really tired all the time or that kind of thing.
Yeah, that's absolutely fair. So the first line medication that we prescribe is an SSRI. Some people know it as an antidepressant medication, but it is also used to be treated for anxiety disorders, of which OCD is one of. And what we like to get you up is to a quite high dose of medication, because the evidence suggests that the higher dose we give, or within the limits of a dose that's acceptable to give, the better outcomes we give. There are side effects to medication, and maybe we can book another appointment to discuss the medication in a little bit more detail, but I'll give you a leaflet on it today, and I'll also give you a leaflet on OCD as well, and the therapy. But there are side effects, but generally these are very commonly prescribed medications, and generally people do tolerate them. And there are other options if the first one doesn't work for you. So that's the medication side of it. Do you have any more questions?
No, that makes sense. Thank you. Yeah.
And then the other side of therapy for OCD is therapy. It's called CBT, which stands for cognitive behavioural therapy. And particularly for OCD, we had a little bit onto it called exposure response prevention, or ERP. So you might hear the terms CBT with ERP. It's a bit of a mouthful, but like I said, I'll give you a leaflet so that you can take it in after we've spoken.
It's not about like talking about my childhood or any of that kind of thing.
Not typically. So you might spend the first few sessions understanding in detail what OCD is and particularly how OCD affects you. And we call that psychoeducation. So you work with your therapist in a safe environment to make a hierarchy of situations that will trigger the thoughts, such as, oh, I haven't locked the door. But then your therapist will stop you from checking that the doors are locked, which sounds really scary. But that way you learn that you don't need to do the behaviour to get rid of the anxiety. So you sit with the anxiety with your therapist.
Until it goes.
Until it goes.
Okay.
And it does sound scary, but you do it step by step, and you'll start with the easiest thing first, and then you'll finish with the scariest thing, and yeah, it gradually gets easier.
Couldn't it just be treated, you know, if I fitted a really complicated alarm system, you know, then I just maybe would stop worrying about it?
It's a very good question, but fitting an alarm system is probably a compulsive behaviour, because that's something you'll do to reduce the anxiety. And we know actually with OCD what you really need to do is sit with the anxiety without engaging in a behaviour to learn that you can get rid of the thought and the anxiety associated with it on your own in order for you to not be stuck in that vicious cycle.
Sure, okay.
Does that make sense?
Yeah, yeah.
And do you have any other questions about the therapy itself?
No, I don't think so.
I should probably mention it's usually face-to-face, and usually it's about 12 sessions, but that's dependent on the individual and the therapist as well, so you can work that out.
Fine. Yeah.
All right. I've spoken a lot today, but thank you so much for coming in. I really appreciate it.
Thank you.
Yeah, I'll see you again.
Thank you.